Hi there, I'm Tanya Zakrison. I'm an associate professor of surgery at the University of Chicago. I'm an acute care surgeon, meaning I do trauma surgery, emergency general surgery, as well as surgical critical care. Today I'd like to talk about COVID-19, equity, and ethics. What is our role as surgeons? And in particular, as trauma surgeons, as we practice trauma-informed care. Trauma-informed care is the idea that patients, when they come into our trauma bays after an injury, we assume they've all actually had a history of trauma, and we will therefore protect them against being re-traumatized by the experience of the resuscitation in the trauma bay. We'll also be mindful of our own experiences as healthcare providers of trauma in the past and how caring for these patients might trigger our own responses, and also be mindful that these patients have family members as well that are affected by the trauma. But it also goes deeper than that. And it goes deeper to the ethical and the societal, political, and economic factors that shape trauma and who is, in fact, affected by trauma, and also who is, in fact, affected by COVID. So we look at these three issues, and the way I like to approach this is thinking of healthcare worker wellness during COVID, societal issues of equity and inclusion, and also structural violence, or the deeper issues of discrimination. For healthcare worker wellness, the American College of Surgeons has an excellent statement that talks about the ability for healthcare workers to speak up and ensure that they have appropriate approach to PPE, so that they are protected on the front lines when treating patients with COVID. We acknowledge that many healthcare workers are in fact living apart from their families for fear of contaminating their families or spreading illness. And we saw that on the New Yorker cover page of the April 6th, 2020 cover. There's a lot of moral distress that we can develop by treating these patients that are dying at a high rate. And that is abrogated by psychological first aid and can be mitigated by such things. So we do think the issue of access to PPE is key and very important for all healthcare workers, nurses, our residents, frontline workers, and environmental support workers as well. I personally believe that the government should invoke the Defense Production Act, not just to produce ventilators with one company or PPEs with another company, but across the board to focus all production towards the safety of healthcare workers, because COVID-19, which is SARS-CoV-2, is similar to SARS-CoV-1, and it's not just spread by droplets, but it's also aerosolized, and we have to be protected as such. The DPA, the Defense Production Act, will also be important because it would across the board protect against price gouging, which is currently ongoing. Another important part when we talk about trauma-informed care is the societal issues of equity and inclusion. This is really important during the time of COVID-19 because we know hate crimes have increased against Asians and Asian Americans. And I encourage everyone to read the statement by the Society of Asian American Surgeons, as well as be directed towards the East for All, or the Eastern Association for the Surgery of Trauma, infographic on the issue of racism and xenophobia. There is a zero tolerance for any of this, and if we see this happening in society at large, we do have a duty and a responsibility as a citizen as well as a healthcare provider to speak up and out against this. The American College of Surgeons has a very clear statement condemning stigma and racism, as does the CDC. We also need to ensure that testing for COVID applies for everyone and that everyone has equal access to testing. There is much implicit bias in the healthcare system, and that means African American communities, Black communities, Brown communities may not have equal access to testing for these implicit bias reasons on a personal level. And we need the CDC to capture race, ethnicity, and class data to ensure that everyone is getting equal access to testing and treatment. Freedom of speech should be paramount. Any healthcare provider that feels that they are at risk for either inappropriate PPEs, insufficient PPEs, or any other reason should have the right to speak up and not fear any retribution or job loss. And that goes for our military healthcare personnel as well. The third issue for trauma-informed care that I like to think about is the issue of structural violence. What are the structural causes of such disparity in outcomes? Why are we seeing, for example, African Americans dying at a higher rate from COVID-19? In Chicago, where I work, the mortality rate is up to 6 times higher for African Americans than it is for white Chicagoans. And that's not a surprise, because structural violence talks about the systemic structures of discrimination that lead to poor health outcomes across the board. That's the same thing that we see in firearm violence. So we think we have a role, and we feel passionately and strongly that we have a role as trauma surgeons in addressing these upstream causes. And part of what we're seeing with COVID-19 is the economic hardships that people are going to be facing and are facing because of job loss. This is an unparalleled level of job loss that we truthfully have not seen since the Great Depression. And for many Americans, with the job loss comes concomitant loss of their healthcare insurance. And that leaves them vulnerable to illness and increased mortality. I personally strongly enthusiastically call for a universal healthcare system because I do feel that healthcare is a human right. We also need to recognize that there's certain communities, in addition to the African American community, that is already disproportionately affected because of these reasons of structural violence. There's other communities that are very much affected by the COVID pandemic. And locally, we have communities that are affected by poverty that have access to firearms, such that homicides and suicides may increase. We're seeing an increase anecdotally of intimate partner violence in the homes as victims are forced to shelter in place with their abusers. There is food insecurity that is going on as children rely on their schools actually for nutritional support and for meals. And another thing that's very concerning is access for homeless individuals for hand washing and good hygiene, as well as incarcerated individuals that are at particular risk of COVID-19 as well. And we just learned yesterday, being April the 8th, 2020, that the Cook County jail system is actually the biggest hotspot for COVID infections right now across the country, and testing remains difficult. We think it's very, very important that if this issue of national unemployment is not addressed in an appropriate fashion, if we don't emphasize the importance of supporting families that have lost employment, that are experiencing new or ongoing economic hardship, this will lead to trauma. This will lead to increased trauma as people become more food insecure, hungry, and need to find means to produce money for their household immediately. We do call upon something similar to the New Deal that was implemented after the Great Depression of 1929. And we need strong, firm support for our families, and not just support for corporations and CEOs. And this will be a very important issue to prevent trauma in the future. We also think as a nation that this is the time during a global pandemic to really put down partisan politics, to really show solidarity with other countries, and to cease hostilities, which are acts of war or sanctions, economic embargoes, which have devastating impacts on the public health of populations. We really are a global village, and we need to demonstrate medical solidarity, especially at this time. And I think it is very true that our response to the virus is indeed a reflection of who we are as individuals, and that's locally as well as nationally and globally. And it's how we want to see our society and our responsibilities to everyone in that society. And I hope that if we truly reflect on how we're going to shape our present and future post-COVID-19 society, that this can be seen by future generations as indeed our greatest hour as surgeons. Thank you very much.